No, I think it's important to hear the perspective and the vision from the other founding member, which is the European Commission. And for this, it's my pleasure to introduce Philippe Cupers, who is the senior officer in charge responsible for the Innovative Medicines Initiative at the Health Directorate of the European Commission. Please, Philippe.
Thank you very much. Good morning, ladies and gentlemen. My talk will be focused on how the Commission perceives the public-private partnership, and in particular, how the IMI joint undertaking can be seen as an example for its participation to such PPPs. Is the microphone on? So the key messages that I would like to address to you today is that the public-private partnership is seen by the Commission in the frame of the 7th Framework Programme as a new tool to support and to address research. And the most important thing is that it has to deliver new competitive research tools that will help to reinvigorate the drug development process for the benefit of the patients, and that will also help to increase the competitiveness of the EU pharma sector in general. So before going into the details of all these aspects, I would like to say a few words about the context, and the context for the EU is always the framework program, which is the legal context, the legal frame by which the EU can support and can fund research in Europe. So as you may know, this budget of the FP7 is 55 billion euro, which is spread over 7 years between 2007 and 2013. And this FP7 contains several pillars. You have pillars for the Euratom, pillars for the Joint Research Center, pillars for IDs, pillars for the individual grants to ERC. But the main important pillar is the cooperation, collaborative research, with a budget of 32 billion euro. And if you go into detail of this cooperation pillar, the red one, which is described here, is that you will see that it contains 10 main research teams. And you will see that several of them are quite relevant also for IMI, but the most important team for you is, of course, the team focusing on health. If you see the individual budgets of all these teams, you see that health has a budget of 6.1 billion euro, out of which 1 billion will be dedicated to the IMI. So it means that the Commission agrees to give 1 billion euro and agrees to give 17% of this team health only to the IMI, to a public-private partnership. And other teams which may be relevant for health are also the nanoscience and nanotech, also the information and communication technologies, which are also very relevant for the e-health, for instance. Now, that said, behind the health team, there is also a certain amount of policies that need to be followed. And I would here identify 3 main policy drivers, the first one being improving the health of European citizens. The second is increasing the competitiveness of the European health-related industries and businesses. And the third one is to address the global health issues, such as emerging epidemics. And each research supported by the health team in this framework program 7 has to address one or several of these main policy drivers. Now, of course, this may sound as a bit of theoretical. What you have to realize is that the FP7 proposes a large variety of tools which are adapted to each specific research challenges, to each specific research niches. So, for instance, for the fundamental research, frontier research, the ERC can deliver individual grants for researchers. For SMEs, there are some specific actions which are taken to support them, to support their research. For the individual training, we have all these Marie Curie fellowships and networks. When member states would like to address some strategic research agenda from some specific disease, for instance, like Alzheimer's disease, we have the joint programming. That can be a tool. So the question is, why do we have, in addition, develop public-private partnership? In addition to all these tools that we have already available, what is the necessity for the Commission to participate in such PPPs? Well, in general, what we see is that there are industry needs which are not addressed and which cannot be addressed by all the different tools that we have until now. We need to address them in a coordinated way and to coordinate the research around them. We also need to address them at a long term. Just to support a project for 2 or 3 years will surely not be enough. So we need to have long-term public-private partnership. And in this case, I would like to underline that IMI is set up until the end of 2017. And clearly, there is an inability for all the other existing instruments to address all these challenges. So PPPs has really to be seen as a new approach to fund and support R&D within the FP7. In particular, what do we want to address with the IMI-GU? What is the challenges that we are facing here? Well, as the previous speaker has described in detail, we are assisting to a decline in R&D productivity, despite the fact that companies have never invested so much money in R&D since 10 years. But nevertheless, the amount of new molecular entities is not increasing in the same way. The second big challenge that we have is a loss of European competitiveness in this sector. There was a time in the 60s or the 70s that more than 60% of the new drug compounds were discovered or set up in Europe. This time is quite far away. And we must find new ways to increase again the competitivity of the European sector in the pharmaceutical industry. That's the reason, two main reasons for which we have participated in the setup of this innovative medicines initiative joint undertaking. As already mentioned, the Commission agrees to put €1 billion as a public partner, while industry also agrees to put 1 billion of its own money in kind and in cash as a private partner. This is by far the biggest initiative we have in the world in health science research as a public-private partnership. So this is something very important. We have not created something low ambition, low scale. We have made something big here to address big challenges.